My name is Robert Davis. I'm an orthopedic surgeon at Beth Deaconess Medical Center. Now, I am a sports and joint replacement surgeon, so I have the privilege of seeing patients when they're physically active, when we can restore their function prior to doing any joint replacements, and when the time comes for that joint replacement, I can do that as well. So I see a wide range of patients, young, middle-aged, and older, all of whom I want to restore physical activity to. The young athlete, the middle-aged athlete, and the older patient who actually needs joint replacement because of arthritis. We start evaluating the patient long before they have surgery. We have case management, we have physical therapy and anesthesia, all services that provide preoperative evaluation and focus on the patients. We help our patients get through the operations before they even have them. I think that's where we excel. I tell people I want you to go out and live your life, and I'm here to help you do that safely and without pain. That is my goal, that is my philosophy, to return function to patients and to get them back to doing what they like to do. My philosophy for talking to patients who are going to have surgery is for them to ask as many questions as they possibly can. I also think it's very important for you to get physically ready for this intervention, to exercise, to strengthen your muscles, and to once again ask as many possible questions that you can to get prepared for the surgery. I think that will help tremendously. Even if you think the questions are insignificant, you need to ask us, and we will certainly answer. But what I enjoy most about being a doctor at Beth Israel Deaconess Medical Center are my patients. I enjoy talking to them. It's a privilege just to be with them in the room. I enjoy people, and I enjoy talking to them. And that's really my passion, taking care of people.